Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Listen carefully. When anxiety shows up, do not treat it as just nervousness. Treat it as a body-brain signal. Ask yourself, why is the alarm system staying on? How is the brain being fed, protected, inflamed, stabilized, or deprived? Anxiety is not only a thought pattern, it is also chemistry, inflammation, membrane function, sleep biology, stress hormone regulation, and nervous system communication. So when we talk about krill oil omega-3, do not imagine a magic capsule. Imagine a nutritional tool that may help the brain become a better environment for calm. Here is the key idea. Krill oil provides EPA and DHA, two marine omega-3 fatty acids. These are not ordinary fats. They become part of cell membranes, influence inflammatory signaling, and participate in the way neurons communicate. The NIH Office of Dietary Supplements recognizes EPA and DHA as the omega-3s most studied for human health, and it notes that krill oil contains omega-3s mainly in phospholipid form, a detail that matters because phospholipids are also central building materials in cell membranes. Now ask the first important question. Why would a fat influence anxiety? Because the brain is not built from thoughts alone. The brain is built from lipids, proteins, electrical gradients, immune signals, hormones, and neurotransmitters. If the brain's cellular surfaces are stiff, inflamed, or metabolically strained, emotional regulation can become harder. So begin with this command. Stop separating mental health from biology. Put them back together. First, look at the evidence with discipline. A major systematic review and meta-analysis published in JAMA Network Open examined 19 clinical trials involving 2,240 participants across 11 countries. The authors found that omega-3 polyunsaturated fatty acid treatment was associated with improvement in anxiety symptoms compared with control groups, with stronger effects in people who had clinical conditions. The effect was not presented as a cure. It was presented as a meaningful association that deserves clinical attention. Now ask, how strong is this evidence? Strong enough to take seriously, but not strong enough to exaggerate. A later dose-response meta-analysis in BMC Psychiatry reviewed 23 randomized trials with 2,189 participants and found that omega-3 supplementation may improve anxiety symptoms, with the greatest improvements around 2 grams per day. However, the certainty of evidence was rated low because the trials differed widely in design, participants, doses, and quality. So use this correctly. Do not say, krill oil treats anxiety. Say this, krill oil may support anxiety management as part of a broader plan, especially when omega-3 intake is low, inflammation is elevated, diet quality is poor, or stress resilience is compromised. Keep that distinction. It protects your credibility. Now let us move into the why and the how. Why might omega-3s help the anxious brain? First, consider inflammation. Anxiety is not always inflammatory, but inflammatory signaling can influence mood, threat, sensitivity, sleep, and stress response. EPA, in particular, can be converted into lipid mediators that help the body regulate inflammatory pathways. Krill oil is interesting here because it delivers EPA and DHA alongside phospholipids, and some clinical research has shown krill oil can reduce high-sensitivity C-reactive protein, a marker often used to assess systemic inflammation in certain populations. Ask the audience, what happens when the body feels inflamed, tense, and under internal pressure? The mind often interprets that internal noise as danger. A tight chest becomes fear, a racing heart becomes panic, poor sleep becomes dread, gut discomfort becomes hypervigilance. So do this, look beneath the emotion and examine the physiology. Omega-3s may help lower some of that background biological static, making it easier for the nervous system to downshift. Second, Consider cell membranes. Every nerve cell has a membrane. That membrane is not a dead wall. It is a living surface where receptors move, signals pass, and neurotransmitters do their work. DHA is especially important in nervous tissue, while EPA is often emphasized for inflammatory and mood-related pathways. If the membrane environment is healthier, the communication between cells may become more balanced. Ask, how can a calmer signal emerge from a better membrane? Imagine a radio with static. The message may be there, but the signal is distorted. In a similar way, the anxious brain may not only need better thoughts, it may need better cellular conditions for those thoughts to land. This is why nutrition matters. It is not motivational language, it is neurobiology. Third, think about stress hormones. Anxiety often involves an overactive threat response system. The amygdala detects danger, the hypothalamus signals stress, cortisol rises, adrenaline sharpens the body, and the person feels ready to escape even when nothing is attacking. Omega-3s have been investigated for their relationship with stress physiology, inflammation, and brain-derived neurotrophic factors. The mechanistic literature does not reduce anxiety to one pathway. Instead, it points to several interacting systems: inflammatory tone, neurotransmission, neuroplasticity, oxidative stress, and hypothalamic pituitary adrenal regulation. Now give this command. Do not expect one capsule to replace therapy, sleep, exercise, breathing, training, sunlight, community, or medical care. Use it as one lever in a system. Why krill oil specifically? Because krill oil packages EPA and DHA differently from many fish oils. In krill oil, much of the omega-3 content is bound to phospholipids. A randomized crossover trial in healthy subjects found that EPA and DHA from krill oil had higher 72-hour bioavailability than EPA and DHA from fish oil in that study, although other research has found comparable absorption when products are matched carefully. So say it accurately. Krill oil may be easier for some people to absorb or tolerate, but it is not automatically superior in every study, every dose, or every person. This nuance is important. Do not buy the marketing. Read the label. Ask, how much EPA and DHA am I actually getting? Many krill oil capsules look impressive on the front, but the EPA and DHA amount may be modest. If the evidence points toward higher daily omega-3 intake for anxiety studies, then dosage matters. Here is a practical sequence. First, check the label for EPA and DHA, not just krill oil 500 mg or krill oil 1000 mg. Second, take it with food that contains some fat, because fat supports absorption. Third, use it consistently for several weeks, not randomly for 2 days. Fourth, track anxiety with a simple scale: morning tension, sleep quality, panic frequency, irritability, and recovery time after stress. Fifth, pair it with the basics: protein at breakfast, reduced alcohol, caffeine awareness, movement, magnesium-rich foods, and regular sleep timing. Ask, why track symptoms? Because anxiety can change gradually. If you do not measure it, you may miss the improvement. You may say nothing happened while your sleep improved, your heart racing decreased, or your recovery after conflict became faster. Track it, observe it, respect small shifts. Also, protect the audience from false hope. If someone has severe panic attacks, suicidal thoughts, trauma symptoms, obsessive fear, bipolar disorder, substance withdrawal, or disabling anxiety, do not tell them to just take omega-3. Tell them this: get professional care. Use nutrition as support, not as a substitute for treatment. Anxiety deserves serious attention. Now address safety. Omega-3 supplements are generally well tolerated, but side effects can include fishy aftertaste, bad breath, headache, heartburn, nausea, diarrhea, and other gastrointestinal symptoms. People taking anticoagulants, people with shellfish allergy, pregnant or breastfeeding individuals, and anyone preparing for surgery should speak with a clinician before using krill oil. The NIH and NCCIH both advise discussing supplement use with healthcare professionals, especially when medications or medical conditions are involved. Ask, how do we use this wisely? Start low if you are sensitive. Take it with meals. Choose third-party tested products when possible. Avoid rancid-smelling capsules. Do not combine high-dose omega-3s with blood-thinning medications without supervision. Do not chase extreme doses because a study mentioned 2 grams. Instead, speak with a qualified clinician, especially if you already take medication for anxiety, depression, clotting, heart rhythm, or blood pressure. Now let us connect this back to everyday life. Think of the person who wakes up with dread before checking messages. Think of the student whose stomach tightens before an exam. Think of the parent who is calm all day, then suddenly becomes overwhelmed at night. Think of the professional who looks composed but lives with internal pressure. In each case, anxiety is not only in the mind. It is in the breath, the gut, the sleep cycle, the inflammatory tone, the nervous system, and the body's interpretation of safety. So give the body better materials. Feed the membrane. Support inflammatory balance. Stabilize blood sugar. Move the body. Train the breath. Sleep like it is medicine. Then, if appropriate, add krill oil omega-3 as a targeted support. Why does this matter? Because anxiety often narrows life. It makes people avoid conversations, opportunities, exercise, travel, sleep, and even joy. The goal is not to erase normal fear. Fear protects us. The goal is to reduce unnecessary alarm so a person can think clearly, connect deeply, and act with steadiness. So remember the central message. Krill oil omega-3 may be beneficial for anxiety because it supplies EPA and DHA, supports cell membrane function, may influence inflammatory signaling, and may help create a calmer biological environment for emotional regulation. The evidence is promising, but not final. Use it intelligently. Use it with measurement. Use it with lifestyle change. Use it with medical guidance when needed. Ask yourself one final pair of questions. Why is my nervous system asking for help? How can I answer it with better care, not just stronger willpower? Start with the body. Support the brain. Respect the science. Stay humble. Stay consistent. Take care of yourself. Take care of each other. And let us keep learning as one family. See you in the next topic.